Well, this summer, the annual trip to the fair might give you more than just an afternoon of fun. So far, 165 people have developed H3N2 flu. This is a new form of swine flu, and you can get it from exposure to sick pigs.
We've had this in the headlines a lot lately. This is up from 16 cases last week, so 90% of those infected, unfortunately, are children. And while none of the cases have been in Colorado thus far, we still want to talk to Dr. Dianne McCallister, who's, of course, the Chief Medical Officer at Centuria's Porter Adventist Hospital, about what this new virus is and how to protect ourselves, especially when you see those numbers going up like that.
Yeah, that's frightening, isn't it?
Yeah.
It is. So talk about what this virus is, because we've heard swine flu before, but this one's a little bit different, right?
Right. So swine flu in general is a flu virus that starts in pigs and ends up in humans. And this is a new one, H3N2. And last year, the CDC noticed it floating around in pig populations, but it's only in the last couple months that we've seen it transferring from pigs to humans. The interesting thing is that we've not yet seen it transfer from one human to another, but it's still early in the outbreak, so we'll have to wait and see what happens.
So we're not talking about food supply here, we're talking about contact with the animals.
Absolutely.
Right?
You can only get this by being around live pigs, eating pork products, and the pork in the store that's been processed isn't dangerous at all.
It's fine, yeah, okay. And so what are the symptoms of this?
Well, you know, the symptoms are very much like any other flu: high fever, dry cough, severe body aches, and then a lot of fatigue.
Okay.
Who's most susceptible? Is it children? We're hearing that that's who's been affected the most so far.
Yes, right now it's predominantly children, and the H3N2, we who are older have probably been exposed to other types of flu that are similar in the past, so we're a little more resistant. But right now we're seeing it in children, and the children they've studied don't have antibodies to it yet. So it's people who've never been exposed to this strain.
And again, it's making headlines more than maybe, say, a regular flu. Is it more dangerous then?
Well, actually, this flu so far has not been more dangerous than the seasonal flu, but there are certain risk groups that are at high risk for complications, and that's those who are over 65, children under 5, pregnant women, people with chronic health conditions like heart disease, lung disease, even severe obesity, and then people who are on drugs which suppress their immune system, so chemotherapy, steroids, and some of the treatments we use for arthritis.
So perhaps the most important question is, how can we prevent it?
You know, the best way to prevent, obviously, not being around pigs is the first thing to do right now. The second thing is, if you do end up around pigs at a state fair, county fair, make sure you're washing your hands really well. And unfortunately, this year's flu vaccine does not cover this strain. So the flu vaccine is very important to get because the other strains of flu are coming, but not this one.
We'll get to the flu season soon enough, won't we?
Yeah, we will.
There's two different kinds.
And just a quick follow-up. So if you're washing your hands, do you have to actually touch the pig to be exposed to the virus or not?
What they're recommending is staying more than 6 feet away from the pigs because it is somewhat respiratory. It gets in airborne particles, so you can breathe it in. So stay about 6 feet away.
Okay, keep your distance.
Don't hug your pigs.
Okay, not today. All right, Dr. Dianne, thank you. If you've got a topic, a question for the doctor, email 11 a.m. at thedenverchannel.com. You can also click on Staying Healthy on our website, thedenverchannel.com, to read the doctor's weekly advice on all kinds of topics.